Hi, everyone. This is Matt Kuntz. I'm the Executive Director of NAMI, Montana. And we just wrapped up the Montana Legislative session. Want to give everybody a quick update on all the work that we've been doing. And we're so grateful to all your support, all your volunteering, donations. I mean, everything made a huge difference. This was an amazing session for us. And I want to break it up into three different categories. So first, outpatient treatment. We really needed to do huge steps on outpatient treatment. This is something that we've been working on for about 7 years. The starting one was even bigger than just mental health. It was Medicaid expansion, House Bill 245 with Representative Ed Buttrey. So critical to the people of Montana, especially those who live with mental health conditions, to be able to work and be able to access Medicaid until their income hits a certain limit. Just absolutely essential for access to care. The next bill was another one that we have been working on for years, trying to rebuild the financing system for our state's behavioral health care. And it's HB 574 by Representative Jane Gillette to implement certified community behavioral health centers. This has been a big effort of the governor, DPHHS, NAMI Montana, Behavioral Health Alliance of Montana, years in the making, ties in with things at the federal level that Senator Daines and others have been doing. So critical, huge step for Montana. There was also a few other bills, SB 170 by Senator Winnie Boy, HB 76 from Representative Howell, and a few other ones that were really critical, like HB 850 by Representative Buttrey for community health workers that built up the workforce. We didn't spend quite as much time on them because there were key groups that were able to move forward with those. So our main ones on that were Medicaid expansion and certified community behavioral health centers. The next phase that I want you to think about is the commitment process and when somebody has to get care against their will. This is a miserable part of our care system, and it's really hard to legislate. And really, it takes us sometimes decades to really get these bills going. But we had a lot of great leadership this time from Senator Esp and Representative Cafaro on these, and the department got involved in some other ones. So, and the Montana Association of Counties, Montana County Attorney Association, just a great batch of partners. First one was SB 435 from Senator Esp, worked with the Montana Association of Counties to really do a solid 72-hour emergency detention process for the state of Montana. We've needed a functional, consistent process like this in Montana for years, and it's really powerful that we're going to get that this session. The next two bills were department bills, Senate Bill 429 and 430 by Senator Esp, and what I think that they did really was set the stage for the need to fix civil commitments, the need to fix community commitments, and to change how we were delivering care at Montana State Hospital, especially in forensic care in the jails. So this was Senate Bill 429 and Senate Bill 430 by Senator Esp. So two really important bills, and we're really grateful to Senator Esp. He just has done so much for our entire care system. And then the next one, which built onto him, was with Representative Cafaro. Again, another thing we've been looking at for years is community commitments, for people who have the level of care where they need to go to Montana State Hospital, but there is a way to deliver that care in the community. We had to set a fee schedule and the rules around those community commitments. And Representative Cafaro worked with us to come up with a great bill, and we were incredibly excited about it, HB 949, and hoping to get that signed by the governor soon. So that's the commitment category. The next category is for forensic care. So people with serious mental health conditions that are tied into the criminal justice system. Again, it's a really hard thing. It's really hard for those people. It's hard for our families. It's hard for law enforcement. It's just a really difficult thing. And we started at the legislative session with Representative Revis bringing a couple of critical bills that brought the attention to the issue and made it absolutely clear that we were having jails in Montana full of people with mental health conditions that the jails were not able to care for. The forensic facility that we have in Galen was not big enough to meet the need to run our legal system and manage the cases of people with serious mental health conditions that are there. So we started out and we worked with Representative Kelly. He's a freshman from Kalispell. He jumped right in and said, let's do this. We were working with Senator Lenz on it and Jennifer Carlson. We put together HB 912 to build a new forensic unit in eastern Montana. And that bill really moved. It went all the way through, got a great votes in the House, the Senate, and then in Finance and Claims, they said, let's do this in HB 5 instead, which is the long-term building bill. It's the right bill. We started the process, said, proved that we needed a forensic unit, and then they moved it into House Bill 5, which is led by Representative John Fitzpatrick. And we do think it's going to end up being a forensic facility in eastern Montana, which is going to be so essential to all of our communities that desperately need fitness to proceed and places to care for people with guilty but mentally ill determination. So it's been a long, amazing legislative session. We're so grateful to all of our partners, all the organizations that we worked with throughout this and through the months. I want to say thanks to Colleen Ron, our education director, that showed up and went above and beyond this legislative session, and to everybody, our entire team, donors, supporters, and the legislators that worked with us. Thank you. I do really believe this is a historic session where we tackled some of the hardest things that we've ever tackled as a state and came out ahead. And we're excited to work with Governor Gianforte moving forward and getting these bills signed and implementing them with his Department of Public Health and Human Services. Thanks everybody so much. Take care.